Last week we talked about the types of diabetes and its symptoms. This week we'll dive into how diabetes is diagnosed. But first we're going to start with some of the basics. According to the CDC, 38 million people in the United States have diabetes. This includes those diagnosed and undiagnosed. And every year, 1.2 million Americans are diagnosed with diabetes. Even more surprising is that 8.7 million adults over the age of 18 have diabetes, but are undiagnosed. So how is it diagnosed? So testing should be done at your doctor's office or a lab, and there are several ways to diagnose diabetes. And no matter which test is used, a repeat test is usually done to confirm the diagnosis. So let's break down the name of those tests. The first test, the hemoglobin A1C test. This is a test that measures your average blood sugar levels over the past 2 to 3 months. It's significant because our red blood cells recycle every 90 days. So if your blood sugars have been elevated, your A1C will be elevated over this 90-day period. The A1C test shows how much sugar has been attached to our red blood cells during this period of time. A normal A1C is less than 5.7%. Prediabetes or impaired fasting glucose is 5.7 to 6.4%, and diabetes is diagnosed at 6.5% or higher. Then there's the fasting plasma glucose test. This test is taken after you haven't eaten or drank anything except water for at least 8 hours. It's typically done first thing in the morning before breakfast. Normal fasting test, less than 100 milligrams per deciliter. Prediabetes or impaired glucose is between 100 and 125 milligrams per deciliter. And diabetes is when it reaches 126 milligrams per deciliter or higher. I'm using the terms milligrams per deciliter, and you might want to know, well, what does that mean? It's a unit of concentration of sugar in your blood. The next test is called the oral glucose tolerance test. This 2-hour test checks your blood glucose levels before and after drinking a really sugary drink. It helps your doctor see how your body processes sugar. A normal test is a reading less than 140 milligrams per deciliter. Prediabetes is 140 to 199 milligrams per deciliter. And then diabetes is 200 milligrams per deciliter or higher. Then there's the random casual glucose test. This test can be done at any time of the day if you experience symptoms of diabetes, and is diagnosed when your blood glucose is 200 milligrams per deciliter or higher. Your doctor will use the results of these tests to determine if you have diabetes, prediabetes, or are at risk for developing diabetes. The earlier you know, the sooner you can take action to manage or even prevent diabetes. Remember that knowledge is powerful, and if you're concerned about your blood sugar levels and have experienced any of the symptoms that we discussed last episode, talk to your healthcare provider about getting tested. Early detection can really make all the difference.